Single payer healthcare is on the way. Here's another watchdog on Wall Street. See, I told you so moment, circa 2009, 2010. Told you it was coming. In fact, Barack Obama told you it was coming. He let everybody know that, quite frankly, he couldn't do universal health care. He couldn't do a single payer system. People wouldn't buy it back at that time. They would do it incrementally by wrecking the current system that we have, and that is Obamacare. The funny thing is that the public is so brainwashed. They have. I'm trying to be kind. I really am. The ignorance is just extraordinary. It really is. You know what it reminded me of? I was thinking about it. There was the movie Idiocracy. And in the movie Idiocracy, they couldn't figure out, okay, you got to understand the movie. It's way into the future and people become dumber. And then the people in the future, they're putting sports drinks. They're using it as rather than water for the crops. And they think this sports drink Brawndo is fantastic because it's got electrolytes in it. Again, it's the same thing, same concept when it comes to Obamacare. Everybody just thinks it's awesome. Awesome. Oh, it's awesome. We got all these people covered. Really? Then how come all of you you people who love Obamacare, you love Obama, how come you guys were taken to the X and to social media and to Blue Sky and all those other places that you hang out at and applauding the fact that you had a CEO shot, healthcare CEO shot last week? Oh, we hate the insurance companies. They're terrible. They're awful. And they deny and they do this. Who did that? Who did that? You did that. You did that. And the funny thing is it's become, it's become a bit of religion on both sides. There's no effort now to repeal Obamacare. Neither party. It's become another, in essence, political third rail. People think it's great, but they don't know why. They think it's great. All of you leftists out, you love Obamacare. You think it's fantastic. I've got coverage. Look what I got. I got coverage. And what? You're okay, fine. You're not paying much. You're getting subsidized on your premium. You got to pay over a $5,000 plus deductible. Good luck. Fine. That a doctor can go on and on and on. But you have it. Anyway, it's amazing to watch. We gotten to a point right now. And it was a great piece today. I got to give credit to Alyssa Finley in the Wall Street Journal and the op-ed pages covering some of this and making some really good points where, she actually talks about how one of the CBS News medical contributor, this Celine Gounder, basically said that these people are that are saying all these terrible things that, they're happy that this guy was killed. They're saying healthcare is so inaccessible and unaffordable. People are justified in their frustrations. Okay. When did this start? Oh, yeah. That was 2009, 2010. I'm on a little bit of personal experience. I just moved to Florida in September. And one of the things you have to do is you have to find new doctors. At least for my wife, it's a bit of a priority. I quite frankly, over the past several years in my experience, I could care less. Quite frankly, I do what I do. I get my blood tested every 6 months, see what's up. I don't, I go. Oh, you got to go there. I got to have an internist. Got to have this. No, I don't. I'll be fine. Last time I went to my doctor and I knew I was sick because I only go to the doctor when I know I need to go to the doctor. They were telling me I'm fine and pumping me with albuterol and all this stuff. And it almost killed me. I was just in the hospital because I had blood clots because of stupid COVID vaccine. That's another story for another day. But anyway, neither here nor there. Okay. Good luck finding one. They exist. They exist here in Tampa, but they're all concierge. Which again, it's fine. I think it's, not a bad business model for these doctors. You got to pay a doctor $100 a month. Then I'll see you. Concierge, that's where it's gone. And there's a reason behind that. Anyway, let's go back. Let's go back to the promises that Barack Obama made. Okay. If you like your health care, you can keep your health care. You like your doctor, you can keep your doctor. Right. Sure. And then the whole pre-existing condition stuff. Again, the best one, the biggest lie out of them all. Oh, yeah, everybody's health care is going to go down by health insurance is going to go down by $2,500. It's going to be more affordable. I'm at almost at the point, I don't even know why I even pay for it. I really don't. I don't get it. It's a racket. I don't understand why I can't just buy a real high deductible policy that covers in case really bad stuff happens. I don't know why they don't offer that. Well, I do know why, because I have to subsidize everyone else's health insurance for all the people that are not paying. Democrats, they got a hand to them. They've kicked ass on a lot of major policy things. Obamacare is the biggest policy initiative going all the way back to LBJ. Let's just be honest. And they have pushed their agenda. They've expanded their control over insurance companies. Again, we're going to subsidize your health insurance. Here, we're going to help pay for this piece of paper that's, it's not worthless for the most part. Lousy insurance products, they are. But anyway, what's happening right now is that people are rather than looking at what the government did and the government's involvement, they're, go after the insurance companies. And what this will eventually do is allow for the Democrats to get what they want, a single payer system. That's what they want, because then again, if you have a single payer system and, the only way to get insurance is through your friendly neighborhood politician, your government, you're going to be beholden to them. Now I'm going to take a quick side note to tell you what eventually happens when you have single payer. Let's go to the UK. Let's go to their wonderful National Health Service. Michael Moore did a documentary on it. And again, I never forget that lame ass opening ceremonies to the London Olympics where they had kids dancing around on hospital beds. This is actually happening right now in the UK. And this is something, it's kind of like a version of Logan's Run if you actually think about it. Terminally ill pensioners could end their lives earlier to spare loved ones six-figure tax bills under assisted dying legislation. Basically, they are encouraging older people, to die before they're 75 years old. If they do that, then they can pass their inheritance onto their family tax-free. Yeah, this is kind of sick. This is going to expand. And you're going to get some sickos out there saying, grandma, I'm really sick. We got to put him in the little suicide box. Oh, yeah, we got to do it. Got to do it quickly. Make sure you do it before they're 75 years old. Then you don't have to pay tax on their inheritance. Again, I don't have any problem with insurance companies cutting deals with people that saying, hey, you know what? I don't feel like going through all of these procedures, whatever it may be. I could do so, and saying, hey, why don't you save this and, cut my family a check because I don't want to deal with this cancer treatment at a certain period of time. But putting people to death? Yeah, coming soon to a theater near you. Well, it's already playing in the UK. Anyway, let's take a look at the numbers. Okay. Finley put these together. $2 trillion more on healthcare today than in 2010. again, get your arms around that number, $2 trillion more. Now, for $2 trillion, you would think that, hey, everybody is healthy. Right. Mortality rates for 25 to 64-year-olds, and this is from major medical causes. Okay, I'm not talking about, we mess around with the mortality rates because of all of the drug overdoses. This is for major medical causes such as hypertensive diseases, diabetes, and neurological conditions. Up since 2010. How about that? $2 trillion more in healthcare. Get the same phenomenon, again, government involvement in education. Do we not? Again, insurance, does insurance change people's behavior? In some cases, it does. They found out that Medicaid, okay, because of Medicaid, again, there's no deductibles or copays if you're on Medicaid. People who are on Medicaid, they go to the doctor all the time. All the time. Every single little thing. We got to go rush to the emergency room for non-emergencies. Why not? I'm not going to pay. The guy over there is going to pay. What the hell do I care, for crying out loud? And it's a reason why. I remember talking about this when Obamacare came out. Everybody's like, oh, it's going to pay. It's going to pay for your annual your annual visit. Your annual visit's going to be great. It's going to be a part of Obamacare. I have car insurance. My car insurance doesn't pay for the frickin' oil changes on my car. Really? You can't afford to go to the doctor once a year to make sure? I mean, that's a big expense. I got another example. Okay. I got a homeowner's policy on my house. Does my homeowner's policy cover air filter changes and when the light frickin' bulbs go out? No. This is stuff that you should be able to take care of by yourself. We got 100, again, staggering, 100, almost a third of the country, 100 million Americans on Medicaid. And you know what the problem is why they're going to hospitals, okay, and making it more expensive. Doctors don't want to take Medicaid patients. The reimbursements, they can't. You can't afford to be in business. You could if you opened up, hi, I'm Dr. Nick Riviera, the knee bone connected to the something connected to the other thing. And you open up your own practice and you say, I'm only taking Medicaid patients. And you decided to go into work every single day, start taking patients at 4:00 in the morning. Yeah, you get tired around. Yeah, you put in a 16-hour day every day, and you're only getting Medicaid reimbursements. You're going out of business. How is that simple? You're going out of business. You're not going to get paid enough. And again, they expanded eligibility with Obamacare, the state, and again, they're trying to, basically hold down Medicaid costs because of this expanded eligibility. So guess what? Reimbursements to doctors go down. Then they say, hey, doctors say, I'm not taking any of these patients. So what do these patients do? They show up at the emergency room. Listen, again, you also talked about deductibles. The average deductible was $5,241 for a typical plan. That's up from $2,425 in 2014. I remember my deductible. I had a high deductible health insurance with a health savings account. This was prior to Obamacare. This was put into place when George W. Bush was president. Rick Santorum was behind this. I remember my deductible for my entire family was $5,000. It's how pathetic and sad it's gotten. So what does this mean? What does this mean? It means single payer healthcare is on the way. And I'm telling people, what are your feelings on that? Well, as long as they have a private insurance opt-out, quite honest, guys, I'm being honest, okay? I don't care. I'm not going on a government plan. I'm not. I'll pay the money. I'll get I actually think I'll probably have much better insurance, or there'll be a better system in place once they go in that direction. Okay, I'm at a point in time, I'm sorry, you sheep out there that believe in all this government bullshit, okay? You want to head in that direction? Farewell and adieu, okay? I can't deal with that. At this point, let it go single payer. Just allow for private insurance outside of that system. WatchDog on wallstreet.com.